Dr. Bledsoe, on behalf of JRS, thank you for coming in today to talk to us about the disparities between minorities in mental health and healthcare in general. To get things started, I'd like to ask you a question. What was the event or catalyst that got you into the mental health field?
Well, first of all, I just wanted to say thank you for having me. I think this is such an important topic. A friend of mine asked me if I needed some work for the summer, and I started working in research at UPMC. And after that, I found my way to a residential treatment facility, and I really started enjoying the work there, working with kids who had difficulties managing their behaviors and emotions, with mental health challenges. Once I was there and realized what I wanted to do, it helped me find my path through counseling and eventually to where I am today.
You've worked in this field for quite some time. As a private counselor with your own practice, as a senior program director at the largest psychiatric hospital in the county, as well as a college professor. What are some experiences you have seen with the disparities in the treatment of people of color from the clinical side and educational side?
Well, I think some of the biggest challenges we see can easily be alleviated, but oftentimes they start as really small things or seemingly small. For instance, challenges around food and food choices. For instance, if somebody is Muslim or Jewish, giving them the choice between a ham sandwich or the bacon cheeseburger for lunch, and not understanding that it's not a small thing, these food choices aren't a small thing for them, that they're really significant challenges and important aspects to who they are as a person and what they believe in. We see things like inequity in care, reduced outcomes. And so, not just in what I've seen, but across the country, when we look at statistics for treatment outcomes, quality of care, satisfaction with care, we consistently see a trend in which people of color or from underserved populations have lower scores in all of those areas. It can be from a lot of different reasons. We can see things like poor access to care, um, misunderstandings in communication, or even biases on the part of the provider, the person, or the facility that's providing the treatment. All of these things equate to negative experiences within the field and decreased likelihood that people will use that service again in the future.
According to NAMI, the National Alliance on Mental Illness, there's a report that 56% of white healthcare providers have had no form of cultural competency training. Can you tell us why it is important to have these cross cultural trainings for healthcare agencies or providers, and who should be the ones responsible for facilitating this action?
Well, without training, oftentimes we miss aspects of a person's disorder, the contributing factors, understanding, really truly understanding the way in which a person perceives and views the world. From a mental health perspective, the challenges that clients and consumers face are oftentimes with the way that they interact with the world. Sometimes it is the biases that they experience, the discrimination that they experience, but also the way in which they perceive the world. Without knowledge of other groups, we can't know some of the challenges that they experience. Now, I can never truly understand what somebody else has gone through. And even if I've gone through something similar, I don't understand their experience with those problems. I can, though, have greater empathy by trying to put myself in their shoes, trying to view the world from their perspective. And I think a lot of times that's one of what's missing from treatment when providers don't have that particular care. If we take food, as I mentioned previously, if I'm a provider and I don't understand the importance of a pork free diet, and I perceive the patient or the client as being disrespectful or resistant or not eating, perhaps thinking that they're not eating because of a faulty perception, then I've completely missed the fact that from a cultural perspective, this person chooses or is not permitted from their own culture to have those foods. And so my diagnosis, my understanding, my perception of the patient is completely off. So without that knowledge of the patient and the patient's cultural background, we truly do the patient a disservice because we are not looking at the biopsychosocial makeup of that patient. And people are made up of all of those things, and we need to take those things into account when we're working with someone.
We know that minorities are hesitant to reach out for help, especially in regards to mental health. Can you share a little bit on why this is a reality for some, and what can we as professionals do to help them feel more comfortable?
People of color and other minorities oftentimes have a great hesitation to reach out for care due to past experiences and also many historical events. We can't talk about inadequacies or unequal treatment or poor experiences without acknowledging the Tuskegee experiment. That is something that many people think was a long time ago, but there were survivors of the Tuskegee experiment well into the late 90s. We also know that people of color oftentimes have negative experiences. There are many studies which demonstrate that the language or the affect or the treatment of providers towards people of color is very different than those from a majority population. It's less collaborative, it is more directive, and in some situations, it's been seen as more hostile. When people of color come into treatment services, if they feel as though the provider doesn't understand their particular challenges based on their cultural makeup, they're much less likely to go back to seek treatment. It takes a lot for people to ask for help. And when somebody asks for help and they're treated poorly or don't receive quality services, it makes it less likely that they'll ask for help in the future. One of the biggest things that treatment providers can do is ask about the experiences of people of color and other underserved populations in regards to discrimination and oppression. I recognize the fact that nothing a provider can do can take away a person's experiences of discrimination or oppression. But what we can do as a treatment provider is say, I'm sorry you've had that experience. I will do everything in my power to make sure that doesn't happen to you here. If I or somebody else here ever treats you in a way that makes you feel disrespected, less than, or that you don't matter, please tell us. We want to do better. And if we make a mistake, we want to know about it so that we can make changes. Acknowledging that we're not perfect, giving our clients and consumers permission to let us know when we've fallen short, and truly caring about making a difference and making changes to help people have more positive experiences, lets people know that it's a safe place. And so when we think about all of this, if we think about it in the context of trauma, there have been many, many historical traumas that people of color have experienced. In order for people who have been traumatized to move forward, there must be safety. And having those conversations creates an environment of safety where people can feel comfortable enough to engage in effective treatment.
What are some resources in the area that are available to minorities that may be seeking mental health treatment but are hesitant to do so?
I think there are many resources in communities that people just don't know about, and I don't think resources oftentimes for those from majority populations and those from minority populations are necessarily that different. Take, for instance, here in the Sally and Howard Levin Clubhouse. This is an excellent resource. I've been here and I've done some work and training with the staff and with the members here. And it's a great resource, but without the knowledge that it's here, it's very difficult for people to find it, right? So I do think while we might have resources, the most important thing is getting the word out about those resources. That entails resources going to the communities, letting people know that they are available by seeking out spiritual elders in the community. That's who a lot of people of color and other underserved populations will go to for help and assistance when they're struggling with things. And so looking for community leaders and community elders to share information about the services that you provide, having fairs, having a comprehensive list of resources that might be available, making connections with other providers within the area. I think that is really what's most important for people of color. Having services that are available through transportation means other than driving one's own car, finding services that are available through public transportation, having shuttles that can provide access to people in different communities. Oftentimes, it's less about a lack of services and it's more about access to those services and recognizing those services are available.
Thank you. Do you feel as though the mental health field and healthcare in general is making any progress to address these changes?
I will say that over the last 20 months, I've seen more done in the field of behavioral health care than I have in the previous 20 plus years that I've been in the field. I think we've had more discussions, we've had more trainings, and we're also moving toward more of a system of doing rather than talking. I think there's a frustration on the part of people of color and other underserved communities that there's been a lot of talk about what's going on and there's been little action. And I feel that now there's more action taking place. There are more programs. We are doing more trainings and expecting outcomes from those trainings. We are looking at ways to include consumers and people of color more in their treatment. I think all of this is pointing toward more of a skill-based change than a theoretical or knowledge-based change, which I think many organizations were leaning towards previously. So I do think there are changes. I also think there's a lot of work to be done, and I'm glad to be a part of it, and I'm glad that you're also a part of it.
Have you personally experienced any barriers or discrimination in your field?
I don't know if I've experienced barriers per se. I feel as though I've been pretty successful in the things that I've done. I have experienced things like being called racial slurs, or patients who did not want to work with me, or families that didn't want to work with me because of the color of my skin. I've also had people question my credentials or look at me in shock or awe because I have a doctorate, and they seem surprised that somebody like me might have that degree. I also think that while there have been some setbacks, it's important to remember that the behavioral health field is just a microcosm of the larger society in which it belongs. And so I wouldn't expect those things to be gone simply because I'm at work. So have I experienced some things? Yes. Did I expect to? Unfortunately, yes. As a person of color, I unfortunately expect to experience some discrimination because that's what we see in society, in the larger society as a whole. I am undeterred though. I think with each experience that I have, or with each experience that the person on the giving end has, it's an opportunity for them to recognize that their what they see as the truth might not be reality, right? When somebody comes to me and they might be hesitant because of the color of my skin and they get better, or they may not want to work with me, but they don't have any other options, and their child or their loved one is working with me and they see that person get better, then it provides an alternate reality for them, and it provides a challenge that what I know to be true might not actually be accurate. And so change comes, um, in order for change to happen, we have to see something different. And if nothing else, I hope that those experiences have provided something different for people that creates a little crack in which light can come in and change can begin.
Thank you. And I'd like to just thank you again for coming in and taking the time to talk to us. On behalf of JRS, we really appreciate this opportunity, and we look forward to being a part of the action in this process.
Well, again, I really appreciate being here today. Um, Change isn't easy, and it's very easy to be set in our old ways and to not recognize the need for change. I think a lot of times it's easy for an organization to say, we're not ready for change yet, but the clients, the families, the people we serve, they don't have time for us to be ready, and so we need to get ready and start the change process now. And so I appreciate the fact that you're willing to undergo the change process and you're actively engaged in it. So thank you for everything that you do and the hard work and support that you give to your members.